in Pelton. Hi, Dr. Pelton.
Hello.
How are you today?
I'm doing good.
Thank you so much for doing this interview. So I'm going to ask you a few questions about you and your experience and what brought you to where you are today.
Okay.
How does that sound?
Sounds great.
Okay. So first off, what do you do here at CHI?
So I am an interventional cardiologist, as well as a general cardiologist. We have 5 of us total. I've got four partners, and we all do interventional cardiology. So we do a lot of mostly general preventative cardiology, but we all can also do stents. We can do peripheral vascular disease interventions. I have an interest in structural interventions as well, and so hopefully in the future we can do more of those things here. So that's a goal of mine professionally. But right now it's mostly coronary work, but a little bit of peripheral.
That's really cool. So was this all as your first choice? Like when you entered med school, like you thought, I'm going to do this?
It wasn't. So I initially wanted to do anesthesia. That was my first thing when I first started med school. And then just because I didn't really get any exposure to it in medical school, then I kind of wanted to do surgery. Really enjoyed my CT surgery rotation. But then I had to do the general surgery portion, and I hated it. The dressing changes and the abscesses, it wasn't for me. And I'd already done a lot of my other kind of core rotations. All I had left was psychiatry and OBGYN, and I didn't like those. So I kind of went back to the drawing board and looked at internal medicine. And since I enjoyed the CT surgery aspect of it, I looked into cardiology, and that's kind of how I picked it, because internal medicine was 3 years and surgery was 5 years, and I could get where I wanted to go a little bit faster by doing internal medicine and then cardiology.
So what made you choose cardiology and then later on interventional cardiology?
So I like the diagnostic part of it. You get to be an internist, you get to diagnose things, you get to examine patients, but you can also use imaging, so you kind of get a little bit of radiology into it. You get the procedural aspect of it from procedures, interventions. There's a lot of intensive care, so I kind of like the critical care aspect of it, a lot of sick patients. You get an instant gratification from a lot of things that you do. And so it kind of checked a lot of boxes off for me in terms of just keeping me excited. Every day is a little bit different. Some days I'm in clinic, some days I'm in the hospital, some days I'm in the cath lab, and it's all different. Every day is different, so it's exciting.
So for people that might not be really familiar with the field, what do you do as an interventional cardiologist? How is it different from general?
So as a general cardiologist, you mostly see patients in the hospital. You mostly see people in the clinic. You do a lot of imaging, so you read a lot of stress tests, you read a lot of echoes. A lot of it's preventative cardiology, which is very important. The interventional aspect of it allows you to do more invasive testing. And there are non-invasive general cardiologists, but they can't intervene on things. So if somebody has angina and they need a stent, a general cardiologist can diagnose that, but they can't treat it. And so an interventionalist, you get further training to put stents in, to do atherectomy, to do interventional imaging or intravascular imaging. You can do structural, so it kind of opens up a lot of more avenues for treatment.
So why do you think someone should choose interventional cardiology?
It's exciting. I mean, I get to take care of very sick people, and a lot of times they get better very quickly, especially for people that come in with an acute coronary syndrome. They'll be very, very sick, and then within an hour they're feeling a lot better, and you get to kind of visually look at that, as opposed to surgery. It may take several weeks for them to heal and to recover, and they're in the hospital for longer, and so cardiology kind of gives me that instant gratification of helping somebody. And not only that, you get to prevent things from happening down the line, which is important too. So it kind of gives you both aspects.
Okay. So to kind of flip on that, why shouldn't someone choose interventional cardiology?
So it is a lot of call. It can be high stress. For example, I had a case yesterday that took about 2.5 hours, primarily because of a lot of interventional. There's things that you have to kind of work through in difficult cases. There's a lot of calcified vessels. It's very difficult to pass equipment sometimes, so you kind of have to kind of think on your feet and kind of come up with things to do on the fly. Some people like that. I enjoy it because it challenges me. Other people may not like the stress of that. the call aspect is kind of an important thing. Fortunately, here we basically do 1 weekend a month and 1 day out of the week, so the call actually is very manageable. But if you're in a smaller group, it might be every other day, or there's some people in town they're on call every day because they're solo. So you have to be in the right practice for you. But I've got great time with my family. We travel a lot. I know my partners travel. I've got a partner of mine that's in Las Vegas right now. So I mean, we all have plenty of free time for family and friends and vacations, and I don't have an issue taking a week off here and there, which is kind of nice to have that balance. And so that's the important thing.
That's good. So, in a specialty that's so like high stress and like go sometimes, how do you manage the stress?
So, and I've stated kind of before, it's when I leave work, I really try not to take work home with me. A lot of times it's impossible. I'll be looking up labs and following up on things and signing notes and stuff. But I try to, whenever I get home, to keep that for my family. That's the main thing. We take little weekend trips. We've got season football tickets for Arkansas football, so we do that every weekend. Our daughter does competitive cheer, so we're in the fall and the spring. That keeps us busy. And so just try to get myself out of the hospital, spend time with family, get some alone time if necessary. Fortunately, my family is very understanding, and they kind of know what I deal with and what I do, and so they've it's all about having a good family support system.
That's amazing. So you talked about how you chose this specialty.
Mm-hmm.
How do you recommend that current medical students go about choosing it?
I would go first what you will not do. I think that for me that was kind of the easiest thing. Like check off, okay, that's a no, that's a no, and then kind of pick 2 or 3 things that you could see yourself doing for 30 years, because that's kind of what's kind of what you're in for, unless you happen to invent something or win a lottery or something. And then once you kind of narrowed it down, get exposure to those things, talk to people in that field, look at what the future employment prospects are. Cardiology is very high in demand. It's you can basically get a job anywhere you want to, unless you want to go to like a big city, New York, Chicago, LA. Some of those markets are saturated, but here, it's very easy to get a job. It's a very competitive salary, so and that does, especially in private practice, that comes into play depending on what lifestyle you want to have. And we're well paid, as a lot of specialties aren't. So you kind of have to look at what you see yourself doing in 15, 20, 30 years, and if that is going to just what you want your life to look like is the main thing. And then the time commitment. Do you have a family? Is it are you able to spend 7 years in training? Are you able, or do you want to only do 3? That's an important part. Do you want to do research? Do you not want to do research? And so I didn't want to do research. That wasn't I purely wanted to be a clinical cardiologist. I was fortunate. My mentor, they recruited me to Baylor. Dr. Lacus, he knew I didn't want to do research. He knew that I was, first and foremost a clinician, and he basically told me, don't do research because you have to, do it because you want to. And so that's always kind of stuck with me. And you do a couple projects, as required, but I wanted to take care of patients. I wanted to be at the bedside, and so that's kind of how I ended up picking where I wanted to train, was based on that. So you need to kind of know what you're getting into.
So you did your medical school at UAMS and residency and fellowship at Baylor. So what do you think was the hardest part about medical school?
That's a good question. This may sound terrible. I did not think medical school was that difficult. I actually had a full-time job during medical school, and that's how I ended up in cardiology, actually. I worked at the hospital I currently work at as a patient care tech during basically the last 3 years of med school. So I would work nights, 7 p.m. to 7 a.m., and then while I was at work, I was reading lectures, studying. So it wasn't that difficult. And then, of course, when clinical years came, because we were more of a traditional program, I didn't get to work as much. And so probably that transition of, being in the hospital and having to learn a bunch of new things at once and different specialties and having to put on different hats. I wouldn't say it was difficult, but it was probably the most stressful aspect of it. Because I thought I wanted to do surgery the whole time, and so when I did my first 6 months of third year, I wasn't looking at rotations like, oh, I'm going to do this. It was like, okay, this is a requirement, and then having to flip gears and say, wait, I don't want to do surgery, but now I'm almost done with third year. I have to kind of figure out what I want to do. That was stressful, but fortunately, I had good mentors. I had good experience here, and I was able to use that to kind of figure out what I wanted to do.
So on the flip side of that, what was the most rewarding or enjoyable part about medical school?
I really enjoyed taking care of the patients, and for the first time, switching from the classroom to the bedside. I think that was fun for me. It was a very, I didn't like sitting in lectures. It wasn't really for me, and so to actually be able to see patients and learn on the job, to me that was the most fun. And so, and plus, it's always more fun to learn by doing instead of like reading about it to me.
Yeah. So you had a very busy schedule in med school. So a lot of times, as a medical student, we're scrambling to find things to do outside of just getting good grades and whatnot. How do you set yourself to be competitive for residency applications?
So I knew very early on, I was never going to be like the straight A going to dermatology or neurosurgery student. So my first 8 weeks, it was like cell biology and something else, and I studied really hard, like really really hard, like more than I'd ever done in my life, and I got like an 89, I think, on the exam. And then the next block, I studied, but I didn't study as hard, and I got like an 86 or like 85. And so I was like, you know what? It's not worth it to me to sacrifice time out of school and when I can be doing other things. And so I just kind of made that decision. Like I was okay with getting B's. And I really excelled in the rotation part. Like I got honors on all my rotations. And I did really well on the shelf exams. And so the classroom work wasn't as important to me as I think it is to a lot of people. But that's a personal decision. We're a lot of type A personalities in medical school, and we've got the gunners and we got the people that, like, if they don't get a 4.0, it's like the end of the world. And that's great. If that works for them, that's fine. I was okay with that not being me. And it's okay too if you don't do as well. And I think people have to understand that it is what you make it. And there are people that didn't do well in the first 2 years that went on to do great things in academics and private practice and industry. And there are people that got a 4.0 that didn't do anything. So I think knowing that grades aren't the most important thing, you have to be well-rounded. And that was, I think, the thing for me. Like I worked full-time. I had a lot of real-world experience that a lot of people didn't have. And had I not done that, I would have never probably picked cardiology. And so everything kind of works out for a reason. And so,
cool. Yeah. So besides the academics, step scores, whatnot, do you think extra things that you do outside, even besides research, other things like working part-time, that sets you apart more than just grades and
I think it does, because you have to remember a lot of times when people go into medical school, they're straight out of college. We have a few people that, they were paramedics or they were nurses for 10 years before, the non-traditional students, but most of us have never really had a job. And so it's a big transition from going from your preclinical years to your clinical years, never having worked for a living. And especially a job like this, where it's very time consuming, a lot of hours, and I think a lot of people aren't ready for that. So that kind of helped me transition a lot easier. It's not for everybody. I did it because number one, I had a lot of student debt, and I wanted to use it to kind of help pay myself through. And there's people that have families, and then maybe they need extra income. Medical school it's definitely not easy. Especially if if you've got families and kids and things like that, you're not getting paid. So it's some people need to do a little extra, but I think it helps set yourself apart, to the same way that research does, to the same way that studying abroad does. I mean, it gives you a different life experience, and everybody's life experience is different. And it just gives you something to talk about in interviews, and it gives you something to write about, and you meet different people, and you get to experience different things, and that's always an important thing in life.
Cool. So with the pandemic, we saw a remarkable rise in social media and healthcare professionals using social media to talk about their experience in the field or sharing lifestyle tips. How do you feel about that? And how do you feel about using social media as a professional? And do you think more people should do it?
I think it's helpful in a lot of ways. I think in a purely academic sense, I follow a lot of people on Instagram and Twitter because of some of the content they post regarding like certain cases that they do, different procedures that they might encounter. Especially on Twitter and with cardiology, you'll never see everything, and so when you get more access to other people's experiences, it's helpful. But I think where it gets challenging is a lot of people they voice opinions on social media that there's a lot of bias in that, and it comes from both sides. You got people that they think a certain way and they are unwilling to see another side. I think that's where it gets kind of challenging, because then there's a lot of mistrust there. We've kind of seen that with the pandemic. You've got the side that are completely anti-vaccinations, and then you've got the other side where it's like, if you don't get vaccinated, you're a terrible person. And so when you have those extremes like that, it's kind of difficult to tease out what's true and not true. So I mainly use it for content related to my field. Somebody saw a complication and what they did about it. It may help me in the future if I have a similar thing happen to me. And so that's kind of what I mostly use it for. I try to stay away from the political aspect of medicine and social media, because otherwise you're going to find somebody that agrees with you, and then there's going to be another person that disagrees with you, and it goes back and forth, and you're never going to get a resolution. So I try just to stay away from it.
That's true. So we're kind of coming to the end. Do you have any last-minute tips or advice for medical students or pre-med students watching this?
Have fun. Go out with friends. You're never going to regret not studying that little extra 6 hours. But you might regret not spending time with your grandparents, or not spending time with your parents or your siblings or your significant other, or kids if you have kids. I'm blessed to have kids now. And I met my wife during medical school, and I actually met her while I was working at this hospital. So it definitely made my life what it is today. So just enjoy it and have fun. It's a short 4-year period. I graduated med school 10 years ago. And I've just been out of training for 3 years. So the best time of your life is coming. Don't get bogged down on some of these small things that might seem significant now. Obviously study hard and try to do as good as you can, but don't kill yourself doing it. It's not the end of the world if you get a B. There are a lot of really great doctors that got C's. So just enjoy it.
Well, Dr. Pelton, that's all I have for you.
All right, thanks.
Thanks so much for your time.
Yeah, thank you.